Assalamu alaikum wa rahmatullah. This is Karamali Sawalha. I'm presenting Neomycin sulfate and bacitracin to respected Ma'am Shahana Wahid. Presentation for Pharmacy Practice, course number 705. Neomycin is an aminoglycoside antibiotic with a bactericidal activity against many gram-positive and gram-negative bacteria. In susceptible bacteria, neomycin prevents the formation of the functional proteins, and as a result, non-functional proteins are formed due to the misreading of the bacterial DNA. This is accomplished through active transport into the bacterial cell and subsequent irreversible binding to receptors present in the 30S ribosomal subunit. Eventually, the susceptible bacteria die because of the lack of functional groups. Bacitracin is primarily bacteriostatic, but may have bactericidal activity depending upon the antibiotic concentration and the susceptibility of the bacteria. Bacitracin inhibits bacterial cell wall synthesis. This is achieved by preventing the final dephosphorylation step in the phospholipid carrier cycle, which interferes with the mucopeptide transfer to the growing cell wall. Now we are moving to the rational use. First of all, it should only be used topically, because systemic absorption of neomycin and bacitracin combination occur after the administration through the oral route. After oral route administration of bacitracin and neomycin, it's absorbed systemically, causing severe unwanted toxic reactions like neurotoxicity, including nephrotoxicity and ototoxicity, even though it's used in recommended doses. And the risk, of course, is higher for the patients or people who are suffering from impaired renal functions. Allahumma salli ala Sayyidina Muhammad. Now we are moving to the irrational use. The concurrent use of neomycin with a diuretic increases the risk of ototoxicity, especially if administered intravenously, as it changes the antibiotic concentration in serum and tissues, resulting in total or partial deafness, even though long after the neomycin have been withdrawn. After the withdrawal of neomycin. Neuromuscular blockage and respiratory paralysis should be considered if neomycin is administered, especially to patients receiving anesthetics. If blockage occurs, calcium salts may reverse this phenomena, but mechanical respiratory assistance may be necessary. Now we are moving to alternative choices. First one is Revoxymin. Revoxymin may be used for all cases of SIBO, which is the small intestinal bacterial overgrowth. It's defined as an increase in the number of bacteria and or the changes in the types of bacteria present in the small bowel. These types of bacteria, which shouldn't present in the small bowel, these bacteria should present in the large intestine. So SIBO, the small intestinal bacterial overgrowth, significantly interfere with the digestion of food and absorption of nutrients, primarily by damaging the mucosal cells. Risk factors include abdominal pain, diarrhea, constipation, gas, and in more severe cases, vitamin deficiencies like B12, coplamine deficiencies, and fat-soluble vitamins like vitamin E, vitamin D, vitamin A, and K, which may cause unwanted severe reactions. Moving to alternative choices. First drug we have is ciprofloxacin and dexamethasone combination. This combination is prescribed for otitis media or otitis externa as an alternative to neomycin. Why? Because neomycin may cause ototoxicity, which is the total or partial deafness. Second alternative is the double beta lactam therapy. This double beta lactam therapy it's used in specific cases like HLAR, which is the high level aminoglycoside resistance. This is a novel approach in case of endocarditis, the inflammation of the endocardium, the lining of the heart, the endocardium. A combination of vancomycin and beta-lactam or daptomycin and beta-lactam administered to patients suffering from inflammation of the endocardium results in microbiological clearance and said to be successfully treated. Now moving to drug-drug interactions. First one, amphotericin B may enhance the nephrotoxic effect of aminoglycosides. If amphotericin B is given along with aminoglycosides, the nephrotoxicity may be affected and increased. Okay, cephalosporins may enhance the nephrotoxic effect of aminoglycoside, and also biphosphonates derivatives. If given with aminoglycosides may enhance the hypocalcemic effect of biphosphonates derivatives because biphosphonates cause low level of calcium in the blood, hypocalcemia, and aminoglycosides may enhance it. اللهم صل على سيدنا محمد. Cholera vaccine, aminoglycoside antibiotic may diminish the therapeutic effect of this vaccine, the cholera vaccine. Same goes to the typhoid vaccine, which may be diminished. The therapeutic effect of the typhoid vaccine may be diminished. As to cholera, same as to cholera. Loop diuretics may enhance the toxic effect of aminoglycosides, especially the nephrotoxicity and ototoxicity. Another drug-drug interactions, which is the penicillins. Penicillins may decrease the serum concentration of aminoglycoside, primarily associated with extended spectrum penicillins, and especially with patients with renal dysfunction. The last one is the vitamin K antagonist, like for example warfarin. Neomycin enhance the anticoagulant effect of vitamin K antagonist. Now moving to antidote in case of overdose. As we said, the usage of aminoglycosides antibiotics is associated with reversible damage to the kidney and irreversible damage to the inner ear, causing ototoxicity. That's why, hence, it's significantly limiting the drug administration. In case of the toxicity, in case of renal toxicity, monitoring kidney function and serum drug concentration is used to reduce the toxicity. Because nowadays, up to date, there are no co-treatment approved by the FDA, the Food and Drug Act, for affected individuals who are suffering from renal or ototoxicity. In case of ototoxicity, hearing aids and cochlear implantations are the only restorative options available. Candidates, autoprotective compounds, these are they are counteracting the aminoglycoside induced hearing loss. اللهم صل على سيدنا محمد. Such promising candidates is so-called berbamine or berbamine, a structurally related alkaloid that reduce the GTTR labeling of zebrafish lateral line hair cells and protects them from aminoglycoside irreversible damage. As we said, in case of reversible damage to the kidney, peritoneal dialysis is carried out to reduce the serum concentrations of the antibiotic and promotes complete recovery of renal function. Last, we are discussing a case study of a 69 years old patient who recently treated for acute renal failure and total deafness induced as a result of intermittent 7-day lavage of surgical cavity with neomycin administration. Because as you said, neomycin is given before العمليات. اللهم صل على سيدنا محمد. Peritoneal dialysis reduced the serum concentration of the antibiotic and promoted complete recovery of renal function. The patient, however, remained deaf, because the ototoxicity is irreversible. This case serves as a reminder that neomycin can be absorbed systemically, following its use as an irrigant solution. Yes. In such cases, it may produce an unsuspected form of high output renal failure and concomitant hearing loss. As we said, the renal failure is usually reversible, but the hearing loss is not, which is frequently permanent. That was all from my side. It's كلام اللي صورها. Presentation of neomycin sulfate and bacitracin to respected ma'am Shahana Wahid. Thank you so much. I hope you ma'am accept. It's a request. Please ma'am accept it, because I couldn't screen record on my laptop as I had some issues, and I tried my best but I couldn't. That's why I'm recording through my phone. Thank you so much ma'am. Jazakallah.